Good day. It's certainly a pleasure to be back with you on the Healthbeat Show. I'm Dr. Jeffrey Watson, and welcome to the Healthbeat Show.
You don't have to take my word, but I heard if you have your health, you have everything. Take my word, but I heard about the Healthbeat you're gonna be. How you wanna be? Show me how it will be. How you wanna be? Show me how it will be. Listen to the show, the more you'll know about your health.
And welcome to this week's version of the Healthbeat Show. I'm Dr. Jeffrey Watson. We're doing a series on the continuum of care. You've heard us say in other shows that there is a whole continuum of care. We've got a new healthcare system coming up. Many of you didn't even understand the old healthcare system. You start out at home trying to maintain your health. You go to the doctor, do what the doctor tries to tell you to do, navigate the medications, lab tests, but you may become acutely ill and then go to the hospital. From the hospital, you may end up in a skilled nursing facility, or you may end up in rehab, or you may go home with home health care services. So we're talking about the continuum. Today we're very fortunate to be at the Gateway Rehab and Convalescent Facility located right here in Hayward. We have a wonderful staff here with us. And joining me with the staff here is none other than the administrator of the facility here, Mr. Joseph Baby. Mr. Baby, welcome to the Healthbeat Show.
Thank you, Dr.
Okay. Tell us the name of the facility, where it's located, and who are these wonderful people who are here with us today?
The name of the facility is Gateway Care and Rehab Center. It's located in 26660 Patrick Avenue, and it's in Hayward. And this is Paul. He's a DOR, Director of Rehab. And that is Shirley Marshall. She's social services. That is Charity Griffin. She's a housekeeping and laundry supervisor. That is Glenda Sandos. She's a regional marketing director. And right. Oh yeah, she's one of our PM shift charge nurses. And that is Judita. She's another PM shift charge nurse.
Okay, well, we have a wonderful staff here. What types of services? Obviously, you've got rehab, you've got social services, you've got some marketing. We're actually in the gym here at the facility. What types of services do you provide here for patients who would come to this facility?
We provide all kind of skilled services. So basically, people come here for rehab and wound care, IV, and pain management. Yes. So once they are out of the hospital, acute hospital, they come here for extensive rehab programs.
And this is one of a series of facilities that I understand we've talked about in other shows. Our television show is based mainly in Oakland, but I understand that you actually have transportation so if somebody came out of one of the Oakland major hospitals, Summit, Alta Bates, maybe even Kaiser, you could allow their family and them to come with transportation here. Is that correct?
That is right, doctor. We provide transportation both for the patients, and we have a van for the facility, and we are more than happy to give a ride to the patient's family.
All right, we're right here at the Gateway Convalescent and Rehab Facility in Hayward. Really a nice facility. I want you to stay tuned. We're going to look at some of the therapies they have here. We'll look at some of the rooms. We'll look at the building itself, maybe talk to some of the nurses and even some of the patients. I'm Dr. Jeffrey Watson. We're talking about the continuum of care right here at one of the skilled nursing facilities, Gateway Convalescent and Rehab. Stay tuned. We got a good one for you. I'm Dr. Jeffrey Watson with the Healthbeat News. As we enter the new year, remember the 8 healthy guidelines of living. Number 1 is prayer and meditation. Number 2 is to read and gain knowledge. Number 3 would be to eat to live, don't just live to eat. Number 4 would be to exercise regularly. Number 5 would be to rid yourself of addictions, cocaine, alcohol, smoking. Be a good time to stop. Number 6, get enough rest and relaxation. 8 hours of sleep, just like Mom said. Number 7 would be to commune with nature. Go outside for a walk, get with the sunshine, get around plants. And number 8 would be to get your regular checkups. That would be to get your blood pressure checked, your sugar checked, a hemoglobin A1C, a mammogram, a colon exam, a prostate evaluation, a heart test. Be tested for HIV, be tested for hepatitis, your cholesterol checked. The 8 healthy guidelines of living. That's what it's all about. If you knew better, you could do better. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth. We're here at the Gateway Care and Rehab Center in Hayward. We're talking about the continuum of care. You may start out at home, end up going to the emergency room, and then from the emergency room you may go to a rehab facility like this one, the Gateway Care and Rehab Facility. Joining me is Mr. Clark, who is a patient here. Welcome, Mr. Clark, to the Healthbeat Show.
Glad to meet you.
Okay, so nice to meet you too. And we have the Director of Rehab Services here at the Gateway Care and Rehab Services. Paul, you can tell me your last name again?
Tabarecci.
Okay,
Yeah.
I'm not even going to try that.
Not many people do.
Okay, now, this is a very interesting device. What is this device and how does it work?
We call this a standing frame, and basically how it works is people who aren't able to stand by themselves, we kind of lock their knees in place, and with a pneumatic pump, they're able to stand up. It basically locks their knees, so the only way up is up.
You know, I used to be an orderly in the hospital, and there would take 2 or 3 orderlies to help get a patient up. So here in this situation, you can use this device, and it can help a person to stand, and it can be done in a safe fashion.
I think that was like the biggest thing. Prior to having this, you definitely have like 2 therapists doing the standing with 1 patient. And now you could have 1 therapist doing the standing, and it's very secure. So we don't have to worry about anyone falling, we don't have to worry about him losing his balance, everything's locked in, and they feel very secure with the standing frame.
Well, let's see how this works with Mr.
Definitely.
Clark. Go ahead.
Okay.
So you pull on this lever here. Mr. Clark puts his hands up. How do you feel, Mr. Clark?
Very comfortable, very secure.
Very secure.
Very
You're
secure.
not nervous that you're
Nervous
going to
or
fall
nothing.
or anything?
I got Paul on my side.
There you go.
He's on my back.
What kind of weight, limitations does this have? Can you put a 200-pound person, a 300-pound?
You could put up to a 250-pound person on this, which for our population works pretty much for everyone, which is nice. And again, as you can tell, that there's a seat in back that guides the hips forward, and with the locking of the knees, the gentleman's going to stand, which is very wonderful for him. And they get the proprioception, they get the input that they need for the standing, and it does the weight bearing. And all this is beneficial to the people that are going to do initially standing to walking to, going home.
Yeah, you may have had a stroke, you may have had a knee replacement, you may have had a broken hip, and you haven't been standing. And this device, what do you call this device?
A standing frame.
A standing frame. This is the first time I've ever seen this.
Yeah, it's, like I said, it's just a wonderful tool that we have, and we're able to use 1 therapist, then 2. And it makes them feel confident in what we're doing and comfortable.
Let's see how it works going back down the other way.
This is the fun ride right here. Just hold on. All we do is just push it forward, and like I said, it's just a pneumatic, and you're going down.
Just like the circus.
There you go.
All right. We are here at the Gateway Care and Rehab. We're talking about the continuum of care. We have one of the devices in the rehab center here. Yep. And we're speaking with the Director of Rehab Services. Stay tuned. We're going to show you more of the Gateway Care and Rehab Center right here on the Healthbeat Show.
Have a good night and rest easy.
Are you tired, sleepy, depressed, snore a lot, sleep a lot during the daytime? Do you have high blood pressure, diabetes, or suffer from sexual dysfunction, you may be suffering from sleep apnea. Talk to your doctor and contact the James A. Watson Wellness Center Sleep Clinic. Remember, we want you to have a good night and rest easy. Give us a call today at 510-444-8627. Remember, that's 510-444-8627, and you'll rest easy.
We're right here on the Healthbeat show at the Gateway Care and Rehab Facility. And this is a high-tech facility. I told you might start out at home, then in the doctor's office, then you might end up in the hospital. From there, you might go to a skilled nursing facility or a rehab facility. Right here in Hayward at the Gateway Care and Rehab Facility, we're speaking with Miss Charity Griffin.
Yes.
Good afternoon,
Good
Ms.
afternoon.
Griffin.
How you doing?
It's so good to see you again.
I know.
All right, we've known each other from long ago.
Long ago.
And what is it that you do here at the Gateway Care and Rehab Center?
I'm the environmental director here, and I make sure that the facility is clean. I make sure that all the devices that we have, all the TVs, everything is installed and it's working proper for the residents. If they have any problems with anything that's in the rooms, I usually come down and make sure that it's all working. And I like working with the residents. I've been working here almost 20 years, and I really enjoy it.
Well, it's a beautiful facility. The floors are beautiful. It's a very well-kept, very nice facility.
Thank you.
And, you know, sometimes people think about going to a rehab or skilled nursing facility. Now, behind me you have a big screen television here, and there's Mr. Jackson. How are you doing today, Mr. Jackson?
Fine myself.
Okay, you're having a good time?
I am.
And what are you doing there?
Bowling.
He's bowling. He's bowling. Mr. Jackson is actually utilizing the Wii game. We're here in the rehab section of the building. They're using this to help him keep his mobility. And how long have you had this device here?
Oh, about 4 months, maybe
About
6
4
months. Yeah, about 6 months.
Very
in here.
innovative.
Yeah.
And I
yeah.
understand that the building is hooked up for wireless computer
Yes, we do.
activity.
Yes, we do. We have all computers. We've all hooked up for computers. All the rooms have big screen TVs like this. Each person have their own microphones, so it don't disturb the other resident. So they kind of like that.
It's a nice place.
Thank you.
That's
Thank you
where I'm
very
going.
much. Thank you
That's where
very,
I'm
very
going.
much. We'd like to have all people come here and really see what it's all about. Because a lot of people get convalescent hospitals. They don't like coming in.
They
them.
get nervous
They
about
get
that
nervous
whole
when they come
idea.
here, yes.
But this is actually a very delightful
very
place.
delightful
because-
place. Everybody's friendly, yes.
Now, you also have a kitchen set up here in which you teach patients through occupational therapy how to work in the kitchen again, how to
Yes.
cook and clean and do those types of things.
Well, you
as
need to know how to do that. You know, when you come in or something happened to you, you have to go home, so you have to have some place to work with. So that's what they train you in here for. And I make sure that everything is clean and in its proper place.
All right.
Okay.
We're right here at the Gateway Care and Rehab Center in Hayward. We're watching Mr. Jackson. He got a strike there. He got a strike. While he's playing Wii, keeping in good shape. We've seen some of the other equipment that we have here. Stay tuned. We're right here on the Healthbeat Show. As we talk about the continuum of care, we are here at the Gateway Care and Rehab Facility in Hayward. We're here at the Gateway Care and Rehab Facility in Hayward. We're talking about the continuum of care. You heard me say that this is quite a high-tech facility, and for some of the patients, they have made available wireless iPads so that people can utilize these. Do you have
This is mine.
This is yours.
They don't provide it. It's expensive.
Oh, that's yours, but they have wireless Wi-Fi here,
Yes.
so that you can.
I can use this.
Okay.
The only thing is, in the rooms, it's a little weak.
Uh-huh.
So sometimes you have to go out to the hallway.
Okay.
Now this says I can't. Oh, now it's okay.
Now you're working it out. And your name is Miss Rivard?
Rivard.
Okay, well, so nice to meet you, Ms. Rivard, and
It's
welcome.
nice to meet you too.
Okay.
It's kind of a fun thing.
Yeah, it is kind of a fun thing. Are you having a pretty good time here?
I'm amazed that I always thought that if I ever got confined in a place like this, I'd be bored to tears. I don't have time to be bored.
So you're having a good time?
Busy.
And we met one gentleman. He's playing on the Wii back there. He's bowling. Do you do that sometimes
I tried the tennis because I used to be a tennis player, but I want to do the full swing. You don't have time for that on the Wii.
Okay.
So I didn't try anymore.
And so through the facility here, they have wireless availability, and you can use your device here. This is the iPad. And are you able to do emails and things like that?
Yes, and I can receive it.
And you can receive it, and can you communicate with your family?
My family, I don't have much. Yeah, my sisters, I do.
Okay. All right, that's good. And you're doing pretty good with the therapy here? And
Yes.
how do you like the rooms? I understand they have flat screen TVs in the rooms.
Yes, great.
So you're having a good time?
Yeah, I like the TV, and I also like the gym. This is a great gym.
This is a great gym. And do they teach you how to work in the kitchen here, too?
No, because with my disease, I may not get home at my age.
Oh, okay.
So-
how long have you been here?
Just a year.
Oh, you've been here a year? Oh.
But when I came here, I could not move. And they had to turn me in. After 2 weeks, I started the gym, and that got me moving.
Are you able to walk?
With the walker.
With a walker?
Yeah.
Isn't
Can't
that
walk
a blessing?
alone. Yes, it is.
Isn't that
Big improvement.
Okay.
Great therapists.
All right. We just met the director of therapy. We're right here at the Gateway Care and Rehab Facility in Hayward with Miss Rivard. Mr. Jackson, he's playing the Wii. He's had a strike on there, and we're having a good time right here on the Healthbeat Show. Stay tuned. We're going to show you some more. We'll be right back. I'm Dr. Jeffrey Watson with the Healthbeat News. In Alameda County, African Americans die at a rate 50% greater than do Caucasians and 150% greater than do Asian, Hispanic, and Island Pacific individuals. The diseases that they die from the most are cardiovascular disease, cancer, and lung disease. I'd like to tell all the men, remember to get your prostate checked. Your prostate should be checked first when you're age 40, and you have to get the digital rectal exam. You also have to get a blood test called a PSA, prostatic specific antigen. The number should be less than 4. If somebody in your family has had prostate cancer, dad, uncle, brother, you're going to be at increased risk of prostate cancer. So when you become 40 and every year thereafter, get your prostate checked, particularly if you're an African American male. I always like to say that if you knew better, you can do better. And remember that your health is your wealth. We are now in the administrator's office in the Gateway Care and Rehab Center, and we're sitting next to none other than the social worker in Miss Shirley Marshall and with the administrator, Mr. Joseph Baby. Now tell me, you know, we're talking about the continuum of care. We've talked about the fact that you could be at home, maybe end up in the ER, maybe end up in the hospital. In the hospital, the case managers are the ones that handle discharge, they deal with the family, they deal with your insurance to some degree. What is it that what is the role of the social worker within the skilled nursing facility?
I would say that the role of the social worker in this sort of setting, the skilled nursing facility, is to help the resident and the family with the discharge planning, whether the resident decide to stay in this type of setting or go home or go into assisted living or a residential care facility. So we're here to assess their need, try to help them move in that direction. We also assist with insurance, equipment, any type of complaints, try to give them heads up on what to expect in this type of setting. For some folks, this is the first time that they've entered into this type of arena. So,
And you know, that's kind of a dramatic thing for families. They come to a skilled nursing facility. It is a dramatic. They think that they're going to be left. We've seen that this place is pretty fun, but they think that they're going to be left in some institution. And so, would you be one of the first people that they would see in part of the intake process?
Correct. Yes.
And would you have them, like, you would do, I guess, ask them questions about their needs and so on?
Sure.
Now, one of the questions patients ask me all the time, they're getting ready to get out of the hospital. One of the reasons they think they don't want to go to a facility is they may believe that they're going to lose their Social Security check. If they have a check coming home being paid by Social Security, let's just say they had a hip fracture and they're going to go in for 2 weeks to rehab or something like that. Would it be typical that they would lose their total check if they were to come in for a short stay into a facility?
Absolutely no.
So they wouldn't?
No, not at all. Not at all.
Okay.
It's only if the patient decide to make this home sweet home, where they want to stay here indefinitely, then perhaps.
Long term.
Yes.
Then if they stayed long term, their Social Security would contribute to the cost of the care.
Correct.
And what kind of insurance covers a skilled nursing facility? What types of insurance?
All kind of insurance like Medicare, Medi-Cal, HMOs, Blue Cross, Blue Shield, Kaiser. We are actually Kaiser contracted facility. We are number one with Kaiser for last 3 years in the area, in Bay Area. So we do all kind of insurance, you know. But most of our patients are short-term, which is mainly Medicare patients.
Okay. Now, does the Medicare, it only pays for a portion of the stay, is that correct?
Medicare pays, Medicare works at, how it works is that it works for 100 days.
100 days.
100 days. So the first 20 days is 100% covered by Medicare. The rest 80 days there is a co-insurance which is $133.50 a day, which is covered by your co-insurance. Let's say you have Medi-Cal, Medi-Cal will cover that co-insurance. But if you are getting any kind of income and if there is a share of cost with Medi-Cal, then you owe that towards the facility.
Okay.
So I think people fear about losing that. In that scenario, they will probably lose the Social Security. But in most cases, they won't. You know.
And Ms. Marshall, you mentioned that you help the families and the patients work with their transition plan coming out of the facility.
Correct.
So that would be discharge planning?
Yes.
And what would be the options, as we talk about the continuum, if you were getting out? What might be some of the options that a person might have coming out of the facility?
Well, the first option is to go back home.
Okay.
Most clients want to come in and get out and go back home. But
When
sometimes
you would
it may
maybe
not.
arrange like visiting nurses or for them to get
Okay,
therapy
yes.
at home? and
Yes,
things
home
like
health
that?
therapy, physical therapy, or occupational therapy, or speech therapy.
And you would make sure that their insurance paid for that kind of therapy that they had at home?
Most time it does. Most likely it will.
What other places might they go if they couldn't maybe just go back to their house? Like
Doctor,
board
they
and
can
care?
go to boarding care, assisted living, or they can stay here.
And if they did, that's a good point. If they did stay here and they had, just regular insurance, we met a very nice lady who said she's been here for a year.
Correct.
She was in bed, she was bedridden, now she can walk. She loves it here, she said. Is there anything that you do from an administrative, paperwork, social services standpoint that allows them to be able to transition to actually living here?
It depends again on their skill level, how much assistance they needed. But if the residents are high functional, we encourage them to go home or go to a next level of, next level of living, like boarding care. But if they need skill assistance and if they don't have, if they cannot go home in that situation, and if it's not considered as a safe discharge, then we will keep them here.
And then would you help them to get Medi-Cal or some kind of insurance that will pay for their long term, or would they have to actually pay cash to live here if they say they had Medicare and some private insurance?
It again depends, if the patient has a lot of money in her bank, in her accounts, the Medi-Cal won't get approved. So she has to pay it as she or he has to pay it as private. Then only we can apply for Medi-Cal. So it again depends, but we do provide assistance in getting the long-term insurance.
Okay. One of the myths and concerns that people have going to a skilled nursing facility is the actual physical plant. And, I'm just going to be honest. Some people are worried that they'll smell bad, they'll smell like urine or things of this nature. This physical plant is beautiful. The rooms have flat screen TVs. It smells nice. We've seen the housekeepers here. We've seen your rehab here. The social services and the administrative and even the marketing and the whole team. You seem to have a wonderful team, as well as the nurses. I want to get a look at them at some point as well. They were kind enough to say hi to us. We're right here at the Gateway Care and Rehab Facility in Hayward, where if you live outside the area, they'll actually go pick you up, bring you here, and have your family come here and visit you. A very, very nice facility. You can play Wii, you can exercise, and there's a nice team of people here to provide all types of healthcare services for you. I'm Dr. Jeffrey Watson. Stay tuned. We're right here on the Healthbeat Show. Here at the Gateway Care and Rehab Facility, how many beds are there? How many patients are there usually at one time?
We have 99 residents.
And it's pretty much full. Patients are always coming here.
Yes, almost 100%, 99. The most is now 90. They come in and out of the hospital. They discharge and then we admit coming in, and then we're gonna get full again.
Now, are skilled nursing facilities rated just like a hotel or any other business? How many stars would you say this facility?
We do 5 rating, 5.
5-star facility. Okay, and I can see why. It's a beautiful facility. Miss Nurse Chulita, did I say it correctly? And you've been here for 20 years.
Yeah.
So you really know what you're doing. You know your way around here.
I'll close my eyes giving the medicine.
You know what you're doing. Okay, yes. We're right here at the Gateway Care and Rehab Center in Hayward, a wonderful 5-star facility. You've seen the rehab, you've seen the high-tech wireless capabilities for computers, you've seen the wonderful nursing, you've seen the wonderful facility, the structure itself. It smells beautiful. I know they have good food here as well. This is where I want to go when I get sick. I'm Dr. Jeffrey Watson. Remember always that your health is your wealth, and when you have your health, you have everything. We hope that you've learned something, because you'll always hear me say that if you knew better, you could do better. This has been our special on the Continuum of Care. We'll see you next time. God bless.